Hi everyone. Today we're talking with Dr. Eddie Stenehjem, MD, about COVID-19 testing. There's been a lot of confusion about testing, so let's clear up a little bit of that confusion. Can you kind of tell us about the requirements for COVID-19 testing?
Yeah, I think first we need to talk and let everybody know that testing is a limited resource. Here in Utah, we have testing available now. We can test through Intermountain Healthcare's lab, the University of Utah through the ARUP, and the State Health Lab. But it's a very finite resource at this point. The reagents, the primers, the swabs, all of that's really in short order. And so yes, we can test, and we're able to test more and more people every day. But we can't test everybody that wants testing at this point. And so we really need to prioritize who we're using those tests on, and we have to do that very carefully as this epidemic evolves.
So can you tell us what those requirements are
Right.
for testing?
So the people that we really prioritize for testing are those that are critically ill, so those patients that are coming into our hospitals and being taken care of in our ICUs, and also those people coming into the hospitals taking care on the regular floor. We need to know who is positive and who is not, so we can ensure that we put in place the best personal protective equipment to protect our healthcare workers and to protect the other patients. So anybody coming into the hospital with the COVID syndrome will get tested. Those are priority number one. We also are really prioritizing our healthcare workers that have symptoms consistent with COVID. We need to be absolutely certain that our healthcare workers are not sick if they're working. And if they have symptoms of COVID, we need to test them to ensure that if they are positive, they stay out of our hospitals and clinics for at least 14 days. So those are priority number one. When we then think about who else do we test and really want to prioritize, we're looking at those people that have chronic comorbid conditions, and so things that really suppress their immune system, so liver transplants, other organ transplants, the elderly, because in those people we really need to know who's positive and who's not, because it's going to affect downstream management. And so those are really our top priority testing procedures. People that are young, that are healthy otherwise, they're not going to be as prioritized as those other folks.
And we've got this question a lot about whether being tested actually makes a difference for someone who's not necessarily in those top brackets. Do you feel like it does make a difference, like that younger demographic, to actually get tested, or should they do something else rather than bog down the healthcare system with trying to get tested?
Right, really good, insightful question. What we think about is, what do you do with a positive test? And if you have a positive test, you're going to go home, you're going to home quarantine, and you're going to ensure that you don't spread it to anybody else. But you should do that regardless if you have a positive test or not. And so those patients that are young, and most young people will have pretty mild symptoms, and many, will have the symptoms of a common cold or a low-grade cough. In those instances, we need those people, regardless if they get tested, to stay home, quarantine, and do not go out and spread this virus to other people, regardless if you're getting tested. Because you're right, in a young person that had mild symptoms, they get tested. We just used one of our test kits that we potentially could have used on somebody who would really make a difference. And so that's why it's so important, regardless if you're tested, that if you have symptoms, that you stay home, you self-isolate, and you do not come out until your symptoms are gone.
And will you just remind everyone what those symptoms are as well?
Right. So COVID-19, obviously we're learning more and more about it every day. Most of the symptoms are what we call lower respiratory tract symptoms. So they're cough and they're fever, and they're just malaise, they're just low energy, just feeling really poorly. Most of those symptoms come on over days and will peak at around day 5 or day 7. But the things to remember: cough, fevers, and shortness of breath.
So we have a few questions that have come in. Will testing volumes get better as we get further along in this process?
Absolutely, yes. The Lieutenant Governor has put together a testing task force with members here in Utah, including some folks from Intermountain Healthcare, to really understand what these supply chains look like and really try to understand what is the timing of ramping up our testing. So they will get better, but right now all of the U.S. is into this crunch of really limited testing resources. And so until those supply chains come online and we have access to everything for testing, so the reagents, the swabs, everything we need, and not until then will we see large volume testing here in Utah.
And along that same lines, can you explain to us what the testing process actually looks like when you go to get tested?
Right. The biggest thing we need to emphasize is you need to be evaluated by one of our clinicians first. And so you can do that in any number of ways. Calling the COVID call center can get you in to speak to a nurse, and that nurse then can make the determination if you should be tested or not. Or you can call Connect Care and get in to talk to one of our providers that way. In addition, urgent care and EDs can do the same process as well. But we really are encouraging people, if you have symptoms of COVID, do not just show up in an emergency department or an urgent care unless you have severe symptoms. Clearly, if you have severe symptoms, get to care as soon as possible. So first, you seek care, whether it be through the call center or the hotline. They'll make a determination of whether or not you have a syndrome compatible to COVID, and then they will work with you to get you tested. Now, just opening this week, Intermountain now has 16 different testing sites. So if you get screened and evaluated by a nurse on the call line, they will work with you and say, hey, you have a testing site near you. I want you to drive up. I've already entered the order, and they will go ahead and screen you. Okay, but it's really important that you have to be evaluated first. We don't want people just showing up to the testing centers without an order for a test or have not been seen by one of our providers.
Makes sense. We had another question come in. What about someone who is asymptomatic and continues to be in the public because of being declined for that test? Is this person at risk?
This is really hard, and we are very early in the epidemic or the pandemic to understand what is the role of the asymptomatic person. We clearly don't have the testing capabilities to go out and test all the asymptomatic folks to see who's positive and who's not. Most likely there is probably a period of viral shedding before you get symptomatic, that there is a potential that you could spread. And that is why social isolation, we can't stress this enough, social distancing is so critical for this. So even if we have people that are shedding virus completely asymptomatic, if they are limiting their exposure to other people, not going out in the community, they're stopping the spread of this virus. We all have a role to play in this, and this social distancing is critical to it.
Yeah. So what can people do if they think they need a test today?
Right. Today, the biggest thing, call the COVID call center or call Connect Care to be evaluated. Those are your first two stops. COVID call center will get you in to talk to a nurse who then can escalate your care, and if you need to be seen by Connect Care, we'll refer you to that. That's your first stop if you think you're symptomatic with coronavirus. COVID call center or Connect Care.
And that number for everyone is 844-442-5224 that you can go ahead and call. And also, as testing gets more wide open to the public, I'm assuming more people will be able to get tested, and it's still going to follow along that lines of who's the most important to get tested, right?
Absolutely.
Okay, perfect.
Your healthcare provider will work with you as more and more tests come online. And that, though, we're still thinking is weeks away. We have enough tests right now to test those that critically need it, those in the hospital, our healthcare workers, those that are immunocompromised. But we don't have the volume of tests to do asymptomatic screening or even young people with mild symptoms. Okay. Those people we're going to say, stay home, don't come out, self-isolate.
Perfect. Yeah. Thank you so much for talking with us today. Again, anyone, if you have questions and concerns about COVID-19, you can call the COVID-19 hotline at 844-442-5224. Thanks, everyone.